Let me ask about another vulnerable group, which is pregnant women with substance use disorder. Again, we've published on this area, and I'm sure you're aware there are plenty of parts of the country where there are laws, in essence, criminalizing having a substance use disorder if you are pregnant, as some form of child abuse, which then has chilling effect on people seeking out and receiving treatment. What are the best practices in the area of addressing this population?
Well, I mean, this is a point that actually, at the end of the day, like many of the issues that we are discussing, relates to stigma. And certainly people that take drugs are highly stigmatized. But of those people that take drugs, the ones that are most stigmatized of all are women that are pregnant. Because there is that moral imperative. What are they doing to the newborn? And that lack of understanding that this behavior is not a choice, and it is in a way a reaction, a response for which there are really not many alternatives for individuals. What we want them is then, how do we treat them? How can we again divert that trajectory that they find themselves on, that will improve their own well-being, but also will improve the well-being of the newborn and the child as it grows along. And we know, and this is research that has been going on for at least 2 decades, that treatment of women that have addictions, and I'm speaking right now for opioid use disorder, are very effective. And they actually prevent them from taking other drugs that are maybe more harmful. They basically protect them, significantly protect them from overdosing. And the outcomes on those children when they are born, we speak a lot about the neonatal abstinence syndrome or the opioid withdrawal, is much lower and easier to handle than when these women are taking drugs like fentanyl and combining it with other drugs like stimulants. So it works. The issue is, why are women not being treated? And then there is where the stigma goes, as you mentioned. And I was horrified when I started to see how many states in the United States actually require that as a physician, if you see a woman that is pregnant and has a substance use disorder, you have to denounce her to child services. And so there is an oversight, and there are 2 states, I don't recall which ones they are, which is good because I don't want to point fingers, but there are 2 states that actually, if you are a woman and you're pregnant, you end up in jail. And obviously, what the fear is, if I am a woman taking drugs and I am pregnant, guess what? If I'm going to end up in jail, I absolutely don't seek medical help, either for my substance use disorder or for the pregnancy itself. So you are really putting women, you're cornering women. And what we saw in the numbers, that's why I actually, the numbers not just speak to us, they shout at us. There has been a tripling in the mortality of pregnant women from overdoses. And this is actually telling us something very compelling, because we have medications that have been shown to prevent, at least by 97%, what other intervention we have in medicine that has that level of protection of overdoses. But we are not, the women are not able to take advantage of it because of all of these stigmatizing practices.
I wonder, as horrifying as that scenario you describe is, my sense, and one of our members of the audience didn't exactly say this, but was talking about who's a provider who's not seeing as much demand as you might imagine, given how many overdoses there are. Even in states without those kinds of laws, presumably the rate of people seeking treatment and obtaining treatment still is far below the numbers who would benefit from it. So I think it's important for us to focus on those 2 states, even if you don't remember which they are. But I imagine this problem of stigma and failure to seek effective treatment is universal around the country, not just because of those laws.
Absolutely. It's just an extreme, right? I mean, if it is, when you are living in a state that has such punitive policies, and you may lose your child. That is a big incentive not to go to treatment.
Right.
In the rest of the country, absolutely, people feel stigmatized, mistreated, discriminated when they actually come up with a substance use disorder. And you hear this again and again and again when you actually speak with people that take drugs and why they don't trust the system. They have been mistreated so badly that they don't want to have anything to do with it. So we do have a problem of trust on the healthcare system or other substance abuse treatment due to the discriminatory practices.